Okay, so I am Sarah Walden, and I'm going to be doing the complete head to toe assessment. And this is my patient, Daphne Lightfoot. And so, Daphne, just want to make sure that you are okay with and consenting to being recorded and participating in this video. Okay, yay. All right, here we go. Okay, so first of all, I'm just going to ask you some questions to judge your orientation. Okay, so what year is it?
2026.
Okay, and what month?
April. Sorry, it's been a long day. April.
Okay, and who's the president?
Trump.
Yes. Okay, and so you're alert and oriented times 4. What are we doing here today?
Doing the assessment assignment.
Okay, perfect. All right. So she's alert and oriented times 4. Your speech is regular and spontaneous, and let's see, you are in no apparent distress, no acute distress right now. You are dressed appropriately for the season and the situation because we are in your house. Okay. So next thing I'm going to do, now I don't have my otoscope with me, so I'm just going to pretend that I do. So I'll use a reflex hammer to pretend like I have that. So
Okay.
I'm just going to be looking in your ears. So I'm going to just pretend like we look in here. And so I can see your tympanic membrane is pearly gray in color. It is what do I want to say, like translucent kind of. I can see the malleus and the long handle, and the umbo, I believe it's called, or umbo, is in the center of the tympanic membrane, and then also the annulus is the ridge around the outside of the tympanic membrane. So all of those things are visible. The cone of light is in 7 o'clock on your left ear, and I would check in your right ear, and it would be at the 5 o'clock, which is where it ought to be. Okay. Alrighty. Pardon the kittens. Okay. So after that, then we're going to go ahead and do eyes. So again, I don't have a otoscope or an ophthalmoscope, so I'm just going to pretend like I'm looking in your eyes. And so I'm going to look with my left eye in your left eye, and I would see the red reflex and be able to visualize the vessels in your retina. There's no drooping or no drainage or anything like that in your eyes. Okay. Same thing, I would use the light to be able to look in your nose and see that the mucosa is pink and moist, and that there's the turbinates are light pink in color, and there's no exudate or epistaxis or anything like that. And then I would also look into your mouth. So I would look in your mouth with the light. So I'll have you go ahead and open. Just pretend and say ah.
Ah.
Okay. So I would look in your mouth and see that your gums are pink. They're I don't see any receding. I don't see any swelling or bleeding or anything like that. Your lips are moist, pink in color, and your mucosa, your tongue, is moist. There's no coating on your tongue, and your uvula is in the center. Your tongue is in the center, midline, they call it, and your pharynx is pink, moist, no exudate, no cobblestoning. So that's it on that. Okay, so then I'm going to feel the lymph nodes. So we've got the pre-auricular lymph nodes right here, post-auricular behind the ears, okay, and then we have occipital right in the back of the neck, all right, and we've got tonsillar right down underneath here. There's a submandibular in here and submental there. And then we've got the anterior cervical down in this line, and posterior cervical back here. And then we've got the supraclavicular lymph nodes. So do you have any tenderness in any of those areas?
No.
Okay, good. So I don't feel any lymph nodes at all. I don't feel any lumps or bumps. There's no tenderness, anything like that. So that's good. All right. So next I'm going to, hi kitten. Okay. So next I'm going to listen to your lungs. So first of all, I'm just going to observe that your breathing is normal. It's not labored. I don't see that you're using any accessory muscles or anything like that. You have kind of like a regular rate and rhythm. So I'm going to go ahead and take a listen. Okay. So listen with the diaphragm part. Have you take a deep breath. There you go. And a deep breath. Good. And get right underneath your armpits here, kind of inside. Okay. All right. Thank you, Lily.
Yes, you're very helpful, sweetheart.
Okay. Okay. So your lung sounds are clear in all the fields. There's no adventitious sounds like crackles or wheezes or rhonchi, nothing like that. Okay. So next I'm going to go ahead and listen to your heart. Okay. Hi, baby girl. Yeah. Okay. My goodness. Okay. So.
It's okay, Lily. I need attention. You're having lunch right here.
Okay. So heart rate is regular, and you can hear S1, S2. That's the love dub. Okay. So we're going to do the aortic is second intercostal space in the right sternal margin. And then the I can't think of the name of it. This is where we can hear the S2 splitting. I don't hear it on you though. That's okay. Okay. And then we have the Erb's point down in the third and fourth intercostal space. And then, just like in the fifth intercostal space in midclavicular. See that one. I don't remember the name of it either. Okay, clearly I need to brush up on the names of those. Hi, kitten. Okay. I'm gonna go ahead and put that down for a minute. All right. I'm gonna go ahead. I'm gonna have you turn your head just slightly to this side, and I'm just gonna feel here, just for a carotid pulse. So that's regular, and then I'm just gonna listen. Listen with the bell. Okay. Don't hear any bruise. All right. Let's see here. So, vascular would look at your legs. You don't have any edema here in your legs or in your feet. Gonna feel your pulses. Okay, so that's regular. Good grief. Alrighty. Okay, so those pulses are equal and they are regular. Okay. So the abdomen, I'm going to go ahead and have you lay down, Das.
Okay.
Maybe put your
Put my head here.
Yeah. How's that? That's good. Okay. You're going to have to move, Lily. I love you, but move. Okay. All right. So, mind if I pull up your shirt a little bit?
Yeah.
Okay. All right. So, see then, so your abdomen is flat. I do not see any scars or any masses. There's no pulsations or anything. So, so we have to go in a certain order. So we're going to inspect first, and then we're going to auscultate the abdomen. So I'm going to start here in the right lower quadrant and listen. The diaphragm. And then go up to the right upper quadrant. And the left upper. And the left lower. Okay. So your bowel sounds are normal active. I can hear them in all four quadrants. So after we inspect and we auscultate, then we're going to percuss. So that is, I'm just going to tap on your belly. Here, Lily, the teachers have to see. Okay. So I'm just going to start in your abdomen over here on the right lower quadrant.
So is that where they get the word percussion?
Mm-hmm. Yeah, like for drums. So can you hear that?
Yeah.
So that's a dole. That's what we would expect to hear. So the percussion, I can hear tympanic, I believe. Tympanic it is. Dole is over the liver and stuff. Okay. So there's that. Now I just need to palpate. So first we're going to do kind of a light palpation. And you let me know if you have any tenderness anywhere.
Okay.
Okay. So and I'm not feeling any masses or anything like that. Now this is going to be a little bit deeper. Any tenderness with that? Okay. Okay. So you don't feel any masses. You don't feel any, you know, like large organs or anything like that. Now I'm going to come over here on this other side, and we're going to, sorry, Des. We're going to feel your, for your liver margins. So this is a little hook maneuver. I'm going to just put my fingers up underneath here. I'm going to have you take a deep breath in I'm just gonna push in. Okay. All right. So margins of the liver. Go ahead and breathe out. So margins of the liver are. I can feel them, so they're well defined. There isn't any like organomegaly, large organs. Okay. All right. So that's it for your tummy. All right. Go ahead and stay there for just a second. I'm just going to check. So, actually, I will have you go ahead and sit back up here again, if you would. Thank you. Okay. So scooch up to the edge of the bed here. I'm going to do a little range of motion.
Oh, okay.
Okay. So first we're going to do upper extremities and check your range of motion in your shoulders.
Okay.
So I'm going to have you put your arms out to your side and then up. Okay. And then we're going to go forward and then see if you can swing them around to the back. Okay. Very good. Very good. All right. Now I'm going to do elbows. So I'm just going to straighten your arm. Okay. And then bend up to touch your shoulder. Okay. There you go. And go ahead and straighten it again. Now I am going to hold your arm like this. I'm going to have you try to lift to like touch your shoulder. Okay, there you go. Okay, go ahead and touch your shoulder and then push down against me. Okay, there you go. So strength is 5 out of 5. So that's good. And then, let's see, some things that we're going to do there. Okay, so then we'll just do some range of motion in your knees and your ankles. So I'm going to have you go ahead and straighten your knee out. There you go. And go ahead and bend it. And I'll have you kind of lift your leg up like this. Okay. Any pain with that?
No.
Okay, good. All right, so we're going to do kind of the same thing as we did before. So I'm going to have you to go ahead and push against me. There you go. Good job. And I'll have you like that. All right. I'm going to have you go ahead and put your feet up just so they can see on the camera. Point your toes up towards your head, okay, and point them that way. There you go. And then can you invert your ankles? All right, and okay, there we go. Perfect. All right. Any pain or tenderness with any of that? Okay, excellent. So strength is 5 out of 5. Go ahead and okay. So have you stand up. We're going to take a look at your back. Go ahead and turn around and just face that way. I'm going to try not to shock you.
Oh, okay.
Okay. So I'm just going to feel your vertebrae. Just palpating all the way down. So your spine is straight. It goes right down the center of your back. I don't see any curves other than the lordosis and the kyphosis that you should have. I'm going to have you just bend forward at the waist, and I'm going to look for scoliosis, like any kind of an S curve, and you do not have that. Okay, go ahead and stand back up. I'm going to have you turn and face the camera. So I'm going to have you do a little range of motion with your back, some extension, go back a little bit, okay, and then lean forward again. There we go. All right. Go ahead and stand up. You're going to do side to side. Okay. And then hands at your side and you can do the side. Both. Okay. Good. Any pain or tenderness with any of that?
No.
Okay. Excellent. Okay. Go ahead and have a seat again. Just going to check. Okay. All right. Actually, I gotta have you do gait. Sorry,
Okay.
have you stand back up. So if you can walk back and forth just in front of the. There you go. Yeah.
Like this?
That should be good. Yeah.
Turn around?
Yep. Go ahead and turn around. Yeah. Come on back. Okay. Go ahead and turn around. Again, I'm gonna have you do heel toe.
Oh, okay.
Heel to toe. just checking your balance. Okay, good. So your gait is even, and there we go. Good job. So your balance is good, and your gait is even for, as far as we could check. Okay, so I'm gonna have you do some fine motor. So just fast with your fingers. Okay, very good. And we're gonna do foot. Okay, awesome. Okay, go ahead and have a seat. Now we're going to do the cranial nerves. So the first cranial nerve is the olfactory nerve, so that's the one for smelling. So normally what I would do then is I would have something that I would have you smell that would be a distinctive smell, and have you close your eyes, you smell it, and then see if you can identify it. Okay, so that's how I would normally test that. The second cranial nerve is the optic nerve. So that one we're going to do some tests here. So we would, for the cranial nerve or the optical nerve, we would do the Snellen chart, where they have the big E, and, to see what your visual acuity is. And then we would do the, peripheral vision by confrontation. So we're going to check that. So I'm going to have you cover your right eye, and I'm going to cover that, my left eye, so we can see the same. We'll be kind of like eye level. Okay. So I'm going to have my hand out here, and you tell me when you can see wiggling fingers.
I can see wiggles.
Okay.
Yep. Yep. Yep.
All right.
Yep.
Okay. And down here. Okay, perfect. All right, so confrontation is good. And then, let's see, the other cranial nerves that do your eyes are cranial nerve 3, which is the trochlear. 4 is, what is it? Oh, cranial nerve is oculomotor, that's 3. 4 is trochlear, 6 is abducens.
There's not a 5?
There is, but it does the face. So that's the facial nerve. So these 3, 4, and 6 do the eyes. So okay, so for those I would do check your pupils. So I'm going to go ahead and do that. Sorry, I didn't mean to.
You're okay. You're fine.
Okay, I'll have you take off your glasses for a sec. Okay, so go ahead and just look straight ahead. I'm going to just shine the light. Okay, so you see your pupils constricting. All right. We do one more time. So I'm going to shine the light in this eye, and I'm going to look at that one. So go ahead and look straight ahead. There we go. So, okay, good. And that's called consensual constriction, and that is where you shine the light in one eye, but the other eye also constricts. So, and that's how it should do. Okay. So there's one more here where I'm going to just kind of shine the light at the bridge of your nose. Go ahead and just look straight ahead.
Okay.
So I apologize if it's bright. I'm just going to shine the bridge of your nose. Okay. And looking at the little white spot that's like right in the corner of your eyes. It's a corneal reflex. And so that's what you have. All right. Let's see. Oh, okay. And then the other thing is we're going to do check the 6 visual fields. So I'm just going to have my finger here, and I just want you to follow it just with your eyes only. So I'm going to go like this. So we're going to do the 6 fields. Okay, very good. And then just keep a look on my finger here. And we're going to check and make sure, so, sorry, accommodation, then make your eyes cross.
Oh,
Okay?
is he crossed?
Yep.
Really?
Yeah, so if you look at it, then it'll keep,
Huh.
yeah. All right, let's see, so then the cranial nerve 5 is the trigeminal nerve, and so for that I would, I'm going to have you close your eyes. And I'm just going to touch lightly. Tell me if you even feel that.
Uh-huh.
Feel that. Feel that.
Uh-huh.
And that.
Yes.
Okay, so little face tickles for you.
I know.
You're like, more, please.
Okay.
Yes. Okay. And then I'm going to just touch your jaws here. I'm going to have you go ahead and clench your teeth. Very good. Okay. Go ahead and loosen up. All right. So then the next thing is the cranial nerve 6, which is the facial nerve. I was thinking that was 5. So 6 is the facial nerve. So I'm going to have you raise your eyebrows, okay, and close your eyes tightly. All right. Go ahead and open them back up again. And then I'm going to have you smile and show your teeth. There we go. And puff out your cheeks. Okay. Very good. Alrighty. Oh, and purse your lips like you're whistling.
I can't whistle. I don't know how it works.
It's okay. Alrighty. Okay. And then cranial nerve 8 is the acoustic nerve. So I'm going to test that by whispering something on each side, and then you tell me what I said. Okay.
Lily is cute.
Yes, she is. Okay.
ABC 1, 2, 3.
Okay, very good. All right. So then the next ones are cranial nerve 9, which is the hypoglossal. 10 is the vagus nerve, and 12 is the hypoglossal. 9 is the glossopharyngeal. 10 is vagus. 12 is hypoglossal. Okay, great. Okay.
Wow.
All right.
It's a lot.
I know it is. That's why I can't remember them. Okay.
Sounds
So
like it's from the Harry Potter movie.
I know, right? So I'm going to have you open your mouth and say ah again. Okay, very good. And then, let's see, so your uvula rises when you say ah, like it should. And I have you stick out your tongue. There you go. And move from the right and the left. There you go. So your tongue moves back and forth and rises midline. And gag reflex, I'm not going to check that, but I trust that you have a gag reflex.
I do.
Okay. And
every time my alarm goes off. Okay,
That's funny. That's funny. Alrighty, so I think that is it. Oh, reflexes. Okay. Excuse me, Lily. Okay, so I'm going to do some deep tendon reflexes on your biceps and on your knees. So I'll just do one side, but I would normally do both sides of all these things. Okay. I'm going to balance it on my other arm here. So you just relax. There you go. So I'm going to feel where your tendons here. And then I'll hit my thumb. There we go. Okay. Very good. All right.
So you don't have to hit your thumb.
I do.
You do?
Uh-huh.
Oh.
Hit my thumb.
But
so the that's just how they do it.
Oh.
And so that was 2+, which is a normal reaction. Okay, go ahead and just relax. There you go. So I'm going to feel ready. There we go. There.
My other one followed suit.
Yes.
Is that normal?
Yeah. Yeah, it's pretty normal. Okay, so that your deep tendon reflexes are 2+. So that concludes the assessment. It's clear I need to practice. All right.